Learning you have valvular heart disease is frightening. Making the prospect far less frightening are the advances made in microsurgery and robotic-assisted surgery as applied to heart surgery. We spoke with Dr. Aidan-Raney of Hoag Memorial Hospital Presbyterian in Newport Beach about these tremendous strides and what they mean to a patient who can benefit from them.
After the patient is diagnosed with valvular heart disease, the next step is really to determine the severity of the disease, whether or not it's something that for the most part they need not worry too much about, or whether or not it's more severe. And the question then is going to be whether it should be treated, and most likely surgically. And then the final question has to be answered is the timing. Should the patient be monitored and carefully followed up, or should the patient undergo a surgical procedure in the near future? As the heart enlarges or gets thickened or hypertrophied is what it's called, then you have consequences of the valvular disease causing potential damage to the heart that may or may not be reversible unless it's corrected properly and on a timely fashion.
What are some of the obvious benefits?
The goal of surgery is really to do a number of things. The first is to stop progression of disease. It's to correct the valvular heart problem and also to restore the heart function back to its normal function. This will allow the patient then to resume normal activities, even to the point where they can resume very exertional types of sports, even running marathons, things like that. And also it helps to restore the heart back to its normal size and function. So there's a number of reasons that the surgical procedure has a great benefit to the patient. People who have moderate to severe valvular heart disease really only have a surgical option as the true correct approach to deal with their valvular heart disease. Once the patient goes to the operating room, we present three options for the patients in terms of their valvular surgical procedure. The first option is a standard incision, which we would use if a patient has, say, a requirement for bypass surgery. The second option is to do a small incision in the middle of the chest called a minimally invasive mini sternotomy. And then the third option that we present is the option to have valvular heart disease corrected with a robotic approach, that is a robotic assisted approach. The surgeon is still doing the surgery, but he's sitting at a console, and it allows to have very small incisions and a quicker recovery time.
And what about recovery and rehabilitation?
The patients with valvular heart disease, some have a shorter course. For example, those who have a robotic mitral valve repair are usually in the hospital 4 days after the surgery on average. Someone who has been sick for a long period of time, who may be elderly, we do valve heart surgery in patients in their 70s, 80s, even some in their 90s. They're going to be in the hospital maybe 7 to 10 days. It depends on the patient. Most patients typically are in the ICU one night, and the very next day we get them up moving around, and most of them go home on the 5th day after the heart surgery.